Can you see him? Yeah, I want his back.
A little more.
A little bit more. Okay. All right, when you're assessing the chest, most of what you're going to be assessing is going to be the posterior part of the back, okay? So what you're going to assess their spinous process. So you're going to go all the way down their back and assess their spinous process. Is there any pain in any of these areas? No, it feels okay? You're going to see if it's kind of in line. All right, now I'm going to do what's called tactile firmness. So I want you to say 99 every time I put my hand on your back, okay?
99, 99, 99.
Good. Okay, and you guys should hear it the best, or feel it the best, I mean, right up in here, up by the scapulus, okay? The next thing you want to do is the chest excursion. So you get your fingers down here, where you can get like how about if I do that? You see?
Yeah.
Okay, so you want your fingers about like this, about towards the base of the ribs, to where you can get like a skin flap there, and then you want them to take a deep breath. So take a deep breath. Okay, and your fingers should move 1.5 to 2 inches when you're doing that. Okay, so that's chest excursion. Now, while he's there, you're going to do the CDA tenderness. So you're going to find that angle, and you're going to hit that angle. Any pain there, Mr. Jones? And I promise you they'll fly off the table if there's pain. While he's here and in this position, you want to listen to their back. So you have him take a deep breath. 1, 2, 3, 4, 5, 6. Remember, because you're doing it at each lobe and you're assessing symmetrical sides. Okay, thank you. All right, so that's pretty much the back part. Now, oh wait, no, now I need you to sit and forward. Turn around.
Just kidding.
Just kidding. Okay, now when we do the front part, and I'm going to go around him, so sorry here, so that you guys can see what we're doing. I want you guys to find your clavicles, go to the second intercostal space on the right. Okay, that's your aortic. Then you come over here to the pulmonic. Then what? Herbs, tricuspid, and then mitral. You're going to listen to all 5 points of the heart. Then you're going to also listen to 1, 2, 3, 4, 5, 6 of the lungs. Okay? Thank you very much. Okay, so that's what you're going to do on the chest for Mr. Jones. All of those things. Did I miss anything on the chest?
No.
Okay. All right. Then we're going to move on. We're going to inspect the abdomen. So we do what first? We inspect,
Listen.
auscultate, percuss, and then palpate on the abdomen. So we're going to listen to all 4 quadrants. You may have to listen for, usually you'll hear it after 3 to 5 seconds. You're going to hear it if they're active. And then, so you listen first. Well, you inspect first. Make sure that there's no masses or swelling or ascites or anything like that. Then you're going to listen. And then you're going to do your percussion. You guys hear the difference? I was doing this last night on my husband, and right in his bowels were just like so tymphonic. I'm like, honey, that's like Borbo or Guinness stuff. But anyways, and then after you do that, then you can palpate, and you want to palpate for masses, for pain. If you're pushing anything and he's like, oh, that hurts right there. Those things need to be notified, okay? So you palpate. Okay, then after, did I do everything on abdomen? After abdomen, you do not, once again, part of your baseline, have to do anything with genitals.
Hey, Jen.
Hey, yes.
Sorry. We're just wondering, do you go right over the pubic bone then? As part of the lower quadrants?
Yeah, you listen right down by the pubic bone, right a little bit above it as part of your quadrants for your Vowel sounds. So yes, but you don't go usually anywhere below that. Okay?
Okay, thank you.
Yep. Okay, and now we're going to go to the lower extremities. So the lower extremities, you want to assess again the skin. You want to assess the symmetry, one between the other. Make sure that both legs look the same. Look for any lesions, look for any, you're going to assess for edema. You are going to feel the pulses. So you've got a break or a popliteal pulse back here. You've got the posterior tibial, which is on the inside. You've got the dorsalis pedis right here.
What if you can't feel it?
What if
like
you can't feel it?
popliteal, it's hard to find on
The popliteal is difficult, and if you can't find it, I mean, I want you to show that you know where to find it, more than if you could find it on every single patient, okay? So I want to be able to know that you guys know where it's at, all right? So you want to feel the pulses. Then you want to do the Homan sign on this feller. Okay, how do I do the Homan sign? What you do is you take the patient and you carefully pull their foot back like this and ask them if they have any pain in the calf muscle. This is indicative of a clot. If you push like this and it stretches that whole thing, oftentimes they will say, "Ooh, that's really sore." If it's just a muscle strain, like a stretching, that's normal. But if it's painful, that's not normal, and that could be indicative of a clot. That's why you do the Homan sign. So you do it on both sides, because this one ain't going to tell you if there's a clot here, so you got to do them on both sides, okay? So then you just lightly pick up their foot and ask them if they've got any pain in the calf area. That's a Homan sign. Okay, when I was telling you guys about clonus, clonus is when you pull the foot back like that and let it go, and it just vibrates all the way back. That means that they are so hyper, like their reflexes are hyper, everything's hyper. Usually their blood pressure is up. Oftentimes, if they're that bad, they will start seizing because their nervous system is so engaged, okay? So that's what's called clonus. You pull the foot back and then it vibrates all the way back, okay? I've seen it happen. So Homan sign. Then you're going to do range of motion. You're going to ask him to open and close his legs, flex his feet, point his toes. Can he lift his knee by himself? Can he twist his leg out? Can he lift his leg in and out this way? Just a little bit of range of motion, see what they're doing. You're also going to want to check their capillary refill here and check their skin turgor you can do on their feet as well, okay? Okay. Then you're going to ask him, you know, does he have any pain? Does he have musculature? Does he have any muscle problems, any muscle spasms? We've kind of looked at the muscles as we've gone along. The last check we've done is partly neuro. We've also already done that when we've assessed his level of consciousness. But the last thing we're going to do is you have to elicit at least 2 of the DTRs. So you choose the ones that you're the best at, and those you need to elicit on your partner. Okay? Once you got the DTRs done, you help the patient back in bed. You tell him, Mr. Jones, thank you for letting me help you with the baseline. You get him comfortable. You cover him back up. You put his side rails up. You need to make sure you tell us that his side rails go up so that we know that he's safe. You put his call light in place. Those are all part of the ending procedures. Get him some water if he's not NPO, those types of things. Now, all through this, you have needed to teach the patient at least one thing. So today I'm going to teach the patient, Mr. Jones, when I was assessing you and I pushed on your bladder, you said that it hurt a little bit. They told me that you're having a hard time emptying your bladder. So it's really, really important. I'm going to leave the urinal right here that you empty your bladder every couple hours, a little more frequently than normal, because if you let it get too full, there may be a problem that way, okay? And if you need help, put your call light on and I'll come in and help you with your urinal. Simply done, okay? Just one thing you need to teach your patient. And then you need to dispose your gloves, take care of all of your equipment, lift the side rails like I said, put the bed back into the safe position, and, provide privacy, wash your hands again, and that kind of thing.
Throughout your exam for our pass off, throughout the exam on our pass off, are we supposed to verbalize everything that we're doing? Like as we're assessing the scan, I'm looking at just basically like we're talking to the patient, but that's
Really
so you know what we're doing. Like if we want to multitask in the head and feel the sinuses and the LOC and things like that, as you're coming in the room, you can kind of knock two things out with one while you're doing a head.
Absolutely.
But you just need to verbalize it for you so that you know what we're doing, right?
Right, because if you're asking the patient questions, just say, I'm just trying to put the patient at ease. I'm just trying to put you at ease, Mr. Jones. I want you talking to them because you're going to have a live person.
Right.
But I also want you to refer to us and say, okay, now we're going to look at your arms. We're going to check the symmetry of your arms.
That's what I mean.
And by saying that kind of stuff, we know you're doing it, and you're also talking to your patient.
That was
So yes,
both of you.
absolutely. Yeah. Okay. Is there any other questions? That's how we're going to do it. Julia, did you have a question?
Yeah. I didn't even turn it on and you saw me move. But I was just wondering if they do have a lot of problems, are you just charting everything while you're doing it? Because you can't remember after you're done.
Yeah. And you do, lots of times if you just have a notebook up here, you can chart what their vital signs were. You can chart that they have a bruise on their left buttocks. You can chart that they have, he said that he had pain when he voids. You can be charting all of this stuff as you're going along. Absolutely. And you guys can bring in a notebook and a pen to chart the vital signs and to chart the different things so you can remember when you go back.
And you
So
don't
yes.
have to follow this list. You just have to cover everything on that list. It's like
You don't have to follow all this list. If you guys do, if you guys don't do capillary refill until the very end, or skin turd until the very end, as long as you hit it sometime, you'll get credit for it. But if we have to say, okay, like the tuning fork thing with mine, that's the one thing I missed, I would have got a point off for it if somebody had to remind me.
But you'll remind us if we forget something.
If you forget something at the end, we'll say, okay, are you done? And you say yes, and we'll say, okay, what about hearing? How do you know for sure he hears? And if we give you a hint, that's 1 point off. And if you still don't know how to do the tuning fork thing, you'll get like 2 or 3 points off for that whole thing. But if once you got reminded and the tuning fork, you show me exactly how to do it, you'll only get 1 point off just for being reminded. Okay? And I know this is hard, and I know this is a lot, you guys, I know it. But I think you can do it. I think it's a long process. Is there any other questions, you guys?
When do we do this? The 20th?
I think you do it the 25th.
I don't think it's terrible as long as you can figure out your own. Like you say, you can
Your own
start at the
little
head and go to the. Because that's how I like to do it.
You know what, you guys? I make acronyms. Like for the lower extremities, mine was CPEAT